Welcome to the deep dive. Today, we're tackling a really significant medical issue, how we can improve treatments for severe burns.
Specifically, acute thermal burns, those caused by heat.
Exactly. And we're going to explore what some key sources say about using hyperbaric oxygen therapy. Breathing pure oxygen in a pressurized room.
Right.
Now, you're here because you want to get up to speed on complex topics, quickly but thoroughly. So our mission today is simple. Pull out the most important insights on this therapy for this type of injury from the materials we've looked at.
And those materials include things like European guidelines, some medical handbooks from different years, even a recent book chapter from 2024.
Yeah, a real mix. And just to be clear, we'll stick to what's in these sources, presenting the information impartially. Okay, let's jump in.
Sounds good. So to really get why hyperbaric oxygen therapy might even be considered, we probably need to quickly cover what actually happens in serious heat burn.
Good idea. What did the sources say?
Well, fundamentally, the heat causes the cells, the actual cellular bits in the skin, layers the epidermis and dermis to, well, coagulate. They get cooked, essentially.
Not a pleasant image. And it's not just a flat layer of damage, is it? I seem to recall something about zones.
That's exactly right. The sources describe it like a target. You've got a central zone of coagulation where the tissue is, frankly, dead, irreparably damaged.
Okay.
Around that, there's a zone of stasis. Here, the blood flow is really sluggish, compromised. This tissue is injured, it's at risk, but it might survive if things improves.
So kind of on the edge?
Precisely.
Hmm.
And then further out, you have a zone of erythema, which is basically reddened, inflamed tissue, but it generally recovers.
So that initial burn sets off a whole cascade then. What happens next physiologically?
Oh, absolutely. The sources detail quite a bit. First, blood vessels get damaged. This causes fluid to leak out from the vessels into the surrounding tissue. That's your swelling, the edema.
Right.
And the vessels also dilate and become more permeable, more leaky, which just makes that fluid shift worse.
Okay, makes sense.
Then, the body's inflammatory response kicks into high gear. You get certain types of white blood cells, polymorphic neutrophilic leukocytes, and monocytes rushing to the scene, causing inflammation.
And the skin itself, our main barrier, is obviously broken. That must cause huge problems.
It really does. Infection becomes a major, major risk. You've got the broken skin, plus the immune system is often impaired after a major burn, and you have dead tissue lying around, which is, a perfect breeding ground for bacteria.
A dangerous combination.
And it gets worse. There's this problem of progressive ischemia, basically, a worsening lack of blood flow.
How does that develop?
Well, the tiny capillaries can get blocked. You can get tiny little clots forming platelet microthrombi, and the blood itself can become more concentrated, thicker.
So gridlock in the microcirculation?
Pretty much.
Yeah.
And all this means the tissues around the burn, especially in that zone of stasis we mentioned, don't get the oxygen and nutrients they desperately need. Add to that, you often see a drop in blood protein levels, hypoproteinemia, and the smallest vessels getting blocked, which messes with the fluid balance even more. And finally, the body's immune defenses, both the cellular ones and the antibody-producing ones, get suppressed, downregulated.
Wow. So it's a multi-pronged attack on the body. Fluid loss, inflammation, infection risk, and this critical lack of oxygen.
That sums it up well. That lack of oxygen, the ischemia, is really key to understanding why hyperbaric oxygen therapy comes into the picture.
Right. So let's connect those dots. Remind us of the basic principle of hyperbaric oxygen therapy again. No abbreviations.
Sure. It's actually quite straightforward conceptually. The patient is placed inside a specially designed chamber, and they breathe 100% oxygen. Crucially, the pressure inside that chamber is increased, higher than the normal air pressure we experience every day.
And the effect of that pressure and pure oxygen combo is?
It dramatically increases the amount of oxygen that dissolves directly into the liquid part of the blood, the plasma.
How much of an increase are we talking about?
The sources mentioned that at around 2.5 times normal atmospheric pressure, 2.5 atmospheres absolute, you can get about a 10-fold increase in the oxygen dissolved in the plasma.
10-fold? That's significant. And what does that mean for getting oxygen out to the tissues?
It means the oxygen can travel much further from the capillaries out into the tissues. One source mentions about a 3-fold increase in the diffusion distance.
Okay, I see where this is going. So if the burn has damaged the small blood vessels and normal oxygen delivery via red blood cells is struggling.
Exactly. This extra oxygen dissolved in the plasma can potentially bypass those blockages or compromised areas.
So this is the core rationale for using it in burns.
Yes. The theory is that hyperbaric oxygen therapy can help overcome that tissue ischemia, that oxygen starvation, even when blood flow is reduced. It provides an alternative route for oxygen delivery.
It directly targets that lack of oxygen caused by the microcirculatory problems, the capillary damage, the tiny clots, the vessels getting squeezed by swelling.
Precisely. It has an anti-ischemic effect. And the hope is, if you start the therapy early enough after the injury,
You might save some of that tissue in the at-risk zone.
that's the potential, yes. It could prevent some tissue necrosis, some tissue death. The sources emphasize that tissue survival is really directly dependent on oxygen levels, on oxygen tension.
So keeping tissue alive that might otherwise die off, that seems like a huge potential benefit.
It could be. But there's an important caveat mentioned.
Which is?
The patient still needs some effective arterial blood flow. If a major vessel supplying an area is completely blocked and there's no collateral circulation, no alternative routes,
Then just loading up the plasma with oxygen won't help because it can't get there anyway.
right, it can't rescue tissue that has absolutely no blood supply.
Uh,
However, even in those difficult cases, the sources suggest it might help demarcate viable tissue from non-viable tissue more clearly.
Helping surgeons figure out exactly what needs to be removed, potentially limiting the extent of surgery.
That's another potential benefit discussed, yes. Helping to define the boundaries for excision.
Okay. Now, you mentioned we have sources looking back over several decades. What kind of results or findings do they report specifically for burns?
Well, there are a few key studies referenced. Going back, there was work by Hart and colleagues in 1974, specifically on hyperbaric oxygen in burns. Then, a 1982 study by Weir and colleagues looked at severe burns.
And more recently,
Research by Cianci and colleagues pops up a couple of times. A 1989 study suggested that adding this therapy as an adjunct, alongside standard care.
right, not instead of, but with it.
Correct. Adjunctive therapy. It suggested it could reduce the length of hospitalization for patients with thermal burns.
Shorter hospital stays, that's always a significant outcome for patients and the healthcare system. Any other findings from that group?
Yes, another study by them from 1988 looked at patients with really extensive burns between 40 and 80% of their body surface area. It suggested the therapy might reduce the need for surgery in a significant portion of these patients.
Reducing the need for surgery in such severe burns would be a major plus.
Definitely. There's also mention of a 1989 abstract, so a summary report by Ray, Green, and Cianci looking at burn patients who also developed a very serious lung complication, adult respiratory distress syndrome.
Okay, so there's a body of research suggesting potential benefits in terms of healing, hospital stay, and maybe even surgical need.
That seems to be the picture painted by these specific sources, yes.
Now, beyond just pushing more oxygen into tissues, are there other ways this therapy is thought to help the body heal from a burn? What are the mechanisms?
That's a really interesting part. The sources list several potential mechanisms of action. Of course, the primary one is increased oxygen availability to tissues that are hypoxic or under stress.
But there's more.
Yes. Some evidence suggests it might enhance the body's ability to break down fibrin clots, so fibrinolytic activity.
Okay, tackling those microclots we talked about.
Potentially. It's also described as having a kind of rejuvenating effect on stressed tissues. And critically for burns, it seems to enhance the function of white blood cells.
The infection fighters.
Exactly. Those cells need good oxygen levels to effectively kill bacteria and other microbes. Adequate oxygen tension is required for their killing action.
That makes sense, given the infection risk. What else?
There's also mention of a possible reduction in edema, the swelling, and then there are effects more related to the rebuilding process.
Like tissue repair.
Yes. Enhanced angiogenesis, that's the formation of new blood vessels, which is absolutely vital for healing.
Right, you need new supply lines.
Also, upregulated fibroblast activity. Fibroblasts are the cells that build connective tissue.
The scaffolding for repair.
You got it. It helps with the formation of granulation tissue, that sort of pebbly pink tissue you see in a healing wound, and it accelerates collagen synthesis, which provides strength.
So it helps build the new tissue faster and stronger.
That's the idea. And one more fascinating point mentioned is increased mobilization of stem cells from the bone marrow.
Stem cells joining the repair effort.
Apparently so. The theory is also that by getting oxygen in, effectively during the early stages, it might reduce some of the harmful inflammatory effects, like neutrophils sticking where they shouldn't and releasing damaging reactive oxygen species, potentially limiting further tissue death.
It really sounds like it could be working on multiple fronts: oxygen delivery, infection control, swelling, and actually stimulating the repair processes.
That's certainly the range of potential mechanisms outlined in the sources we looked at.
Okay, this all sounds promising, but any medical procedure involves safety considerations. What do the sources, particularly the European Code of Good Practice you mentioned, say about safety?
That code is quite comprehensive. Its whole scope is the safety related to this therapy, safety for patients, for the staff running the chambers, any third parties involved, and the infrastructure itself.
So what are some key takeaways from those guidelines? Staffing, for instance.
They emphasize having a properly trained and sufficient team. For a multiplace chamber, one that can hold several people, the minimum recommended team during a treatment session is usually one hyperbaric physician, one inside attendant who goes in the chamber with the patients, and one outside operator. And someone needs to be the designated supervisor.
A minimum team.
Yes. But importantly, the code stresses that the actual team size and composition should be based on a thorough risk assessment for that specific facility and its operations.
Risk assessment sounds central then.
Absolutely critical. The guidelines mandate identifying potential hazards, medical ones related to the patient's condition, technical issues with the chamber, mechanical problems, administrative procedures, environmental factors, even human factors.
Covering all bases.
Trying to.
Yeah.
Then you have to evaluate the likelihood and severity of these risks, document everything, make sure staff are aware, and decide if existing controls are adequate or if more needs to be done.
And these aren't just done once.
No, they need to be reviewed regularly, at least annually, and certainly updated if anything changes, new equipment, new procedures, lessons learned from incidents. They also require documented standard operating procedures.
What about the people running the show? The staff training?
Also covered. The code outlines educational and training standards for the different roles within the hyperbaric team, stressing that it's a multidisciplinary effort. Everyone needs to be competent for their specific tasks.
Okay. And are there any inherent dangers in the hyperbaric environment itself that needs special attention?
Well, the big one is always fire risk, because you're dealing with a high-pressure, oxygen-enriched environment.
Right, oxygen fuels fire.
Exactly. So the guidelines put a huge emphasis on fire prevention systems, rigorous testing of equipment, strict protocols about what can and cannot go into the chamber, and ensuring staff are extremely well trained in fire safety procedures and emergency drills.
It sounds like safety is taken very seriously, as it should be.
It has to be.
Now, apart from environmental risks like fire, what about potential complications from the therapy itself? Does it have side effects?
The sources do acknowledge general risks associated with exposure to high pressure and high oxygen concentrations. Things like ear or sinus problems due to the pressure changes, or potential oxygen toxicity effects, especially on the lungs or central nervous system.
No.
But they also state clearly that the established treatment protocols, the specific pressures used, the duration of treatment, the air breaks incorporated, are all carefully designed precisely to minimize these risks.
So following the rules is key.
Extremely key. Careful patient selection is also vital, ensuring the potential benefits outweigh the risks for that individual. While our sources didn't dive deep into complications specifically in the burn patient context versus others, the overall principle is that adherence to protocols maximizes safety.
Okay, so let's try and pull this all together. Based on the sources we've explored today, what's the bottom line on hyperbaric oxygen therapy as an additional treatment for acute thermal burns?
Well, based purely on this information, it comes across as a potentially valuable supportive therapy. The rationale is strong tackling that tissue ischemia.
Right, the oxygen delivery.
Yeah. And the sources point to potential benefits like preventing further tissue death, maybe reducing surgical needs in some cases, possibly shortening hospital stays.
And those other mechanisms too, fighting infection, reducing swelling, boosting repair.
Exactly. Stimulating various parts of the healing cascade. But it's also clear that its effectiveness likely depends on things like burn severity, how quickly you start it, and crucially, that some blood flow still exists.
And the safety aspect is paramount.
Absolutely. Strict adherence to established safety protocols and guidelines, like those in the European Code, is non-negotiable to manage the inherent risks of the environment and the therapy itself.
This deep dive has definitely illuminated what these sources say about the potential and the practice of using hyperbaric oxygen therapy for these severe injuries. It's quite a fascinating intersection of physiology and technology.
It is.
So, as we finish up, here's something for you, our listener, to think about. Considering everything we've discussed, the mechanisms, the outcomes, the limitations, what do you think might be the single most critical factor that truly determines how effective this therapy is for any given burn patient? Is it the timing, the burn depth, something else?
That's a good question to ponder.
Definitely something to mull over. As always, we hope this has been informative. We encourage you to look into the research more if you're interested, and obviously always consult qualified medical professionals for any personal health questions or advice. Thanks for joining us on this deep dive.